Today we met for the Youth Mental Health and the Arts Roundtable.
We're the co-directors of CREATE, which stands for Creativity in Research, Engaging the Arts, Transforming Education, Health and Wellbeing.
The role of CREATE is to bring people with resources, people with understanding of arts and health together to make these things possible.
The question really is around what are the possibilities for the arts in this space, using more visual and performative and literary ways of sharing empirical research. I guess for me it was just turning to other ways to share our research information with these key stakeholders.
Some of the really practical work that PYT Fairfield does, so our catchment area is in southwestern Sydney. We have the highest refugee population, I think, probably in the state. There's enormous barriers to accessing the arts. But I always wonder if we capture the people that we really need the most.
Unfortunately, with mental health, there's always a lack of funding. When the funding does come through, usually the last place that it will go to would be things like, psychosocial recovery or investing in arts or investing in other kinds of areas. And in my experience, what we've recognised is that the arts, all different types of art, has been a real carrot to get young people to engage in their treatment, and also a big part of continued recovery post the mental health treatment as well.
Milk Crate Theatre's been talking to Create Centre about a social impact measurement framework, and I think really there was a lot of justification out of today just to drive that project forward. Having a common platform where we can all talk together about the impacts of the sector and build a body of evidence is obviously really important and is going to help us all.
For a lot of these young people, it's about social connection and behavioural activation, getting them out of the house, but also looking at the process, that a lot of the time it isn't driven by the end result. They're not going to make an artwork a lot of the time together at the end of it, but it's the process and learning new skills and connecting with others.
It's fascinating to hear how well acknowledged it is that the arts have a significant impact on social and emotional health and well-being, and that seems to be broadly understood.
And it's not only the communication, it's about really building exciting new forms of knowledge that get at and intervene in the problems that we all share and we all really care about. That so many people here work in and have networks in and operate within Western Sydney in education and in the arts and in the communities. So surely there's an opportunity there for us to all sit down and have something that talks practically on the grassroots level and epistemically and programmatically and systemically up those other levels that we want to have in place.
Today was really very strongly for me about bringing together creativity and creativity from both psychology, mental health and the arts. I had a really strong sense that people needed to work with each other to convince each other about what was important, but also convince government and convince community about the importance of bringing together arts and mental health. We've started the conversation, but we really need to think quite strategically and quite ambitiously about what can happen.
There's enough goodwill and enough potential in this space to really make a difference for adolescent mental health, to do better for our young people, to give them the opportunity to engage in the arts and to provide support for their mental health and their well-being.
I think that goodwill and enthusiasm and the possibilities that emerged out of today and the resonance between the different groups augurs well